Hi, I am Dr. JP Silvera from TaylorMade Health and Wellness, and 2 days ago, a patient sat down across from me and said something I hear almost every single week. She looked at me, a little embarrassed actually, and said, I felt completely fine right after the accident. I thought I was okay. And here's the thing, she was not wrong. Right after a collision, even a minor rear end crash at low speed, your body does something remarkable. It floods your system with adrenaline. That adrenaline acts like a volume knob on your pain signals, and it turns them all the way down. You can stand on the side of the road, have a calm conversation with the officer, shake hands with the other driver, get back in your car, and drive yourself home. You feel shaken, maybe, but not hurt. So you tell yourself you got lucky. Then the adrenaline fades. That usually takes anywhere from several hours to a couple of days. And when it does, the neck stiffness shows up, the headache right at the base of the skull, the shoulder that just does not want to move the way it did yesterday, the tightness between your shoulder blades every time you try to turn and look over your shoulder while backing out of the driveway. That is not a coincidence. That is your body finally reporting what happened. So, what actually happened in a rear end collision, even a slow one? When your car takes a hit from behind, your body goes through what we call a whiplash motion. Your head and neck get thrown backward and then forward faster than your muscles can voluntarily react. The soft tissues, the muscles, the ligaments, the tendons, the discs between your vertebrae, they absorb that force. And soft tissue does not show up on a standard x-ray. You could walk out of an emergency room with a clean x-ray and still have significant soft tissue damage that is going to make your life uncomfortable for weeks or months if it goes unaddressed. This is the part that most people do not know, and it is the reason I wanted to make this video. There is a window of time after an accident where getting a thorough evaluation matters more than almost anything else. Not because you should assume the worst, but because finding out exactly where you stand puts you in control. If nothing serious is wrong, you get peace of mind. If something did happen to the alignment of your cervical spine, or there is muscular compensation happening on one side, or you have early inflammation in a joint, finding that early means the recovery is dramatically faster and more complete than if you wait until the pain becomes impossible to ignore. That patient I mentioned at the start, we checked her out, we explained exactly what we found in plain language, no jargon, and we built a care plan around her specific injury. We also handled the insurance paperwork on our end, so she was not sitting at home trying to figure out whether auto insurance or health insurance or PIP coverage applied to her situation. 6 weeks later, she was back to normal, not managing symptoms, back to normal. Now, I want to address something I hear as an objection sometimes. People say, it was just a fender bender, it was not a serious accident, and I understand that completely. Nobody wants to feel like they are making a big deal out of something minor. But the research on this is actually pretty clear. The speed of the collision does not reliably predict the severity of the soft tissue injury. A crash at 15 miles per hour can produce more cervical strain than one at 30, depending on the angle, the headrest position, whether you saw it coming, whether your muscles were braced or relaxed. The physics are more complicated than the damage to your bumper suggests. So, if someone you know was in a crash recently and keeps saying they feel fine, tell them that is actually the best time to get checked out. Not when it hurts, before it hurts, or in those first few days when the adrenaline is still doing its job and the full picture has not shown up yet. What we do at the evaluation is straightforward. We talk through exactly what happened. We assess your range of motion. We look at your posture and how your spine is aligned. We identify any areas of inflammation or restriction, and then we tell you plainly what we found and what, if anything, we recommend doing about it. There is no pressure. There is no guessing. It is just a clear picture of where you are so you can make an informed decision. If you are in the Clermont area and you have been through something like this, even recently, even if you feel fine right now, I would genuinely encourage you to come in and let us take a look. And I am curious, for those of you watching who have been in an accident before, how long did it take before you realized something was actually wrong? Drop it in the comments.